Hi everyone, this is Dr. Mohan, consultant orthopedic and reconstructive surgeon and also medical director at Nano Hospitals, Bangalore Road, Bangalore. There are multiple tendons around our body. Any tendon can get ruptured if there is an excessive strain on the tendon, but there are other conditions wherein even a minute stress also can cause a ruptured tendon, as in degenerative conditions. A tendon becomes degenerative means over a period of time due to repetitive use or with the age, the tendon becomes weak. Multiple fibers are there, few fibers get injured, they don't heal and they become degenerated or old or weak. Once a weak tendon is put into even a minor stress, sometimes ruptures of the tendon happen. Or if they are rubbing against any projected bone, then all projected implant, the frictional forces can also cause ruptures of the tendon. Symptom wise, if it is an acute rupture, generally you will have extreme pain and swelling. On clinical examination, we will be able to see if the tendon function is there or not. If the tendon integrity is there, can be seen again by clinically examined to see if there is any integrity issue. Then acute tendon injuries has to be surgically repaired only. In degenerative or a tendon which has become already weak over a period of time and then ruptured with a small injury, the pain and swelling would be little less than an acute injury. They may not be very pronounced because it's already there for a very long time. Depending upon the amount of tendon or the severity of the rupture, we take a call on conservative methods or surgical methods.